Hello, this is Dr. Shaza Muhammad, and I'm presenting a research conducted by me and two of my colleagues, Dr. Hiba Rabia and Dr. Hanan Sulaiman. Our research is on knowledge and practices of hand hygiene amongst healthcare and non-healthcare workers in Al Quwain primary healthcare centers of Ministry of Health and Prevention, UAE. As we all might know, hand hygiene practices, including the use of alcohol-based hand rub or hand washing, has proven to be an effective and simple way of preventing the spread of pathogens and infections in healthcare settings. Healthcare providers, as described by the CDC, clean their hands less than half of the times they should. The CDC recommends that healthcare workers or healthcare providers are required to perform hand hygiene in accordance with the CDC recommendations using alcohol-based hand rub with 60 to 95% alcohol in healthcare settings. Unless hands are visibly soiled, an alcohol-based hand rub is preferred over soap and water in most clinical situations due to evidence of better compliance compared to soap and water. Moreover, hand rubs are generally less irritating to hands and are effective in the presence of a sink. Our aim from the study was to evaluate the knowledge and practice regarding hand hygiene amongst healthcare workers and employees working in primary healthcare centers in Al Quwain, Ministry of Health and Prevention, UAE. The methodology of the study is a cross-sectional observational study that was conducted from May 2019 to December 2019, observing the knowledge and practices of healthcare workers and non-healthcare workers in Al Quwain primary healthcare centers. Data was collected from questionnaires that were distributed routinely. The questionnaire constituted of 3 parts and were distributed out to the healthcare and non-healthcare workers in the primary healthcare settings. Our results reveal that 100% of the physicians and dentists had a good level of knowledge in hand hygiene. Also, 100% from reception staff had fair knowledge and 0% had good knowledge. There were significant statistical differences between mean knowledge scores in the different work categories and educational level, respectively. There was no significant difference in knowledge score between those who had an infection control training course and those who did not. Moreover, 83% of physicians had a satisfactory hand hygiene practice, 89.7% of nurses had a satisfactory hand washing, and 79.3% had satisfactory hand rubbing practices. Receptionists did not practice a satisfactory hand washing. 71% had a satisfactory hand rubbing technique, whereas 100% of dentists had a satisfactory hand hygiene practice. In conclusion, the general level knowledge and practice of healthcare workers were good, but there was a gap between those who were in direct contact with patients, like the physicians, dentists, and nurses, compared to other work categories. This gap may break the infection control cycle and lead to nosocomial infections. Hence, the recommendations are directed towards holding training courses more frequently, as this may improve the performance of healthcare workers. These training courses should be more practical to ensure being beneficial. Monitoring is an important part to identify areas of weakness. Thank you.